A dog bite may look like a small wound, but it can cause serious infection and may carry the risk of rabies. Knowing what to do immediately can protect your health and possibly save your life.
Step 1. Get safe first, move away from the dog, and make sure you are safe. If possible, remember what the dog looked like and where it went. Do not try to catch an unfamiliar or aggressive dog. Step 2. Wash immediately the bite wound with plenty of clean, running water and soap for about 15 minutes. This is one of the most important first aid steps to reduce contamination. Next step is to control bleeding. If the wound is bleeding heavily, apply firm, direct pressure with a clean cloth or dressing. Once bleeding is controlled, cover the wound with a clean dressing. Last step is to get medical care. Seek medical attention as soon as possible. Even if the wound looks minor, a healthcare professional may assess the need for tetanus protection, antibiotics, and rabies post-exposure treatment.
Watch for infection. Warning signs include increasing redness, swelling, warmth, worsening pain, pus, fever, or red streaks spreading from the wound. These require urgent medical attention. Finally, remember, never ignore a dog bite. Wash the wound immediately, seek medical advice, and act quickly when rabies exposure is possible.